So if you've had an injury before and you felt like it was just a subtle injury, however, a week later, 2 weeks later, you still have pain, this is something that you need to come to hospital, that you may be checked. So warning signs that patients should never ignore include inability to bear weight. If you have pain that is associated with weight loss, night sweats, meaning that when you're sleeping at night, you're sweating, you do not have an appetite. Those are things that, if it is associated with pain, especially even back pain, it could mean more than just simple pain. And also, pain that has lasted a long time should also be a worry. First of all, let me look at it in two ways. For example, if a patient is post-trauma, so pain that lasts more than 2 weeks, if you have had some chest injury, rib fractures that have not been attended to, and you have difficulty breathing, those are things that you need to go to hospital. If it is after abdominal injury and you have persistent pain, these are things that need to lead you to hospital. If you have pain in the absence of trauma and it has lasted more than 2 weeks, this is also something that needs to be looked at by a doctor and to be evaluated correctly. However, just as a caveat, there are some conditions that do not present with pain. For example, there are many tumors, many cancers that present as a painless lump. So if you notice anything that is out of the ordinary, if it is a female, you're performing frequent breast exams and you notice a swelling that has not been there before, this is something that you need to talk to a doctor about. In many conditions, early reviews provide a better prognosis for a condition. For example, if you find cancer, if you have osteosarcoma of your distal femur or of your leg, if you should get your diagnosis at stage 1, that is before progression of disease, then that will lead to a better outcome and a better prognosis for your condition. If you should present late, like you come in at stage 4, the prognosis, the percentage of people who survive stage 4 is much less than those that survive stage 1. My advice, you need to go to hospital frequently and have frequent checkups to be able to catch conditions early and provide the best prognosis for your condition. Visit us at Apex Orthopedics at 5th Avenue Suite. We are here to take care of your pain from trauma, from back pain, and also from joint pain, from arthritis. Karibu Apex, compassionate care.